show today. Well, you may know how to fix the flat on your bike or your car, but sometimes our bodies can go a little flat, right?
Yeah.
It happens. Well, never fear, because today we're giving you fixes for all your flats, from your feet to your booty to your flat hair and a whole lot more. Are you checking out your booty over there?
Well, I've got some booty props.
Well, we're going to get to that in a minute, because a lot of people feel that a flat... Put the panties away. We were shocked by this jaw-dropping story.
O'Neal Morris was charged with practicing medicine without a license and accused of inflating the cabooses of unsuspecting clients with dangerous chemicals. Morris, known as Duchess, injected their derrieres with chemicals, including Fix-A-Flat aerosol and cement, sealing the shots with, get this, super glue.
Police say this photo shows that Morris, who was born a man, first used them on himself. We're told Morris's victim suffered pneumonia and MRSA from the injection.
Ms. Morris, can we hear your side of the story? Were you injecting your patients? Were you posing as a doctor? I have a lawyer.
Prosecutors said more of Morris's victims are coming forward.
We do have other victims, specifically right now, 3 other victims in Florida coming forward.
These pictures show hardened lumps on Raji Narayan Singh's face. Raji, who was born a man, says she took a chance and had O'Neal Morris perform procedures on her face, buttocks, and chest. Dr. John Martin says he spent the past 3 years trying to fix Raji's face. The plastic surgeon says Raji thought she was getting silicone in her face. He doesn't know what was actually injected.
I could have died.
Wow. Those are tragedies. Those are really, you know, I mean, I have friends, patients and girlfriends who are always asking, you know, what should I do? It's not only do you want to go to a doctor, you know, board-certified physician, but you also want to go to someone who does these things well and safely. Right. And there's no deals, right, Drew? I mean,
there are no shortcuts.
No.
And it's just unbelievable that somebody would do this to another human being.
This is way below just being a con artist. This is just the lowest form of humanity.
And this is one of the things that we're going to get into, that, you know, we all want to look better and feel better about ourselves. But this cocktail that Dr. Travis has here is unbelievable.
Dr. Orr, would you even know? So this is an emergency flat tire repair. So you start looking at what's in here, and you can only imagine what it's going to do within your body's tissues and the inflammatory process it's going to start. You've got mineral oil, paper, cement, and then using super glue to close up the wound.
You know, the thing is we're physicians, and we know what it's going to do to the body. A lot of people think they can use other things that are around and, you know, pump up the body. It's going to pump up something, you know, just like it does with a tire. It's going to pump up your body the same way, but they don't know the consequences, and they're huge, huge,
That's exactly it, doctors. It's part of it is what happens when you first put it in, but it's a time bomb. The worst is yet to come. It shifts. The body reacts to it. It becomes inflamed. It can get infected. You can die from this.
Yes.
Yeah, right. The chemicals either leach into the rest of your body, or the body walls it off and forms some sort of a cyst. Yeah.
Exactly. Impossible to remove 100%, because it's so entwined in the muscle, around the nerves, the blood vessels, in your fatty tissue. I mean, you literally would have to remove a whole body part to eliminate it from the body.
You can change the rest of your life by doing this incorrectly.
Yeah. If you read this, recommended for a car, sedan, truck, trailer, minivan, SUV, it does not say recommended for injection into the human body.
Yeah.
No.
So this is where you have, it's always better safe than sorry. And actually, in a rare interview, our own Dr. Orden interviewed one of the alleged victims, Raji, and a reconstructive surgeon, Dr. John Martin. Have a look.
So, Raji, tell me, how did you get involved with O'Neal Ron?
I am a transgender woman, and, you know, I was on hormone therapy for a while, and I was at the point where I wanted to take my transition further and didn't have the resources financially to do so. So because I didn't have the resources, I chose to go this route.
You knew this person wasn't a doctor, and the injections were basically being done in an apartment.
That's correct. I started with my face. So my face was fine. It actually looked really good at first. And then that's what made me continue.
And as you know, with any silicone or any of these implants, the inflammatory reaction can start years later.
We all want to look good, but you have to be careful.
The first thing that people see when they look at you is your face. That's the first thing. And I had to go through that horrible experience of having a distorted face, the surgery. I was told that the surgery would take a little over an hour. I was on the table for about almost 4 hours.
When she first came in to me, she said, I feel like a monster, because she had these huge nodules on the side of her face.
What I would like to do is, if the two of you are willing, is to actually take a closer look. So you started on her left cheek, correct?
Right. This cheek was much worse. She really had some very large nodules. So did a facelift incision so that we'd have access through a flap to try to get to some of these nodules.
And I understand, Dr. Martin, that you literally described what you found in here, the consistency of rock.
It was like a rock. It felt like you were cutting into concrete.
Rarely can you remove all of it because it's so intertwined with the muscles of your face, the vessels, the nerves. This is the medical grade silicone that is available to us. Now, wasn't this more like the container that you would see? And they would draw it out with a syringe.
They would draw it out with a syringe and then inject it in me.
And you started off flat-chested, correct?
I did.
So your augmentation has all been done with what you...
With whatever substance she
either
used.
silicone or mineral oil. I do feel some areas of a little bit of lumpiness, so you need to have an expert look at this yearly. And what is the message?
Don't do it. Go to a certified plastic surgeon, because you could become very, very ill or even die. And I know that's what could have happened to me.
Wow, that's disheartening. You have to be careful because there are more alleged victims that have come forward as this case is developing. One of the most recent, Shaquanda Brown, was also reportedly injected with a similar substance as Raji. She wanted to make her bottom, she said, as big as the Duchess. Well, her attorney, Spencer Ehrenfeld, takes on cases like this in the South Beach area, has some words of advice for everyone considering a cosmetic procedure.
As a result of these injections, you almost lost your life. Tell us about that.
I was getting like flu-like symptoms, nauseous, dizzy, lumps on the buttocks. They started leaking, so I had to go to different hospitals to figure out what was in me. I spent 30-something days in the hospital.
She had MRSA and a staph infection. This is a very, very lucky lady.
Spencer, I know you have a lot of experience dealing with these type of problems.
Unfortunately, most of the clients I've represented will spend more time picking out a pair of shoes than they will selecting their plastic surgeon. So you want to take your time. Do not be in a rush and don't be pressured. You want to search the website of your Department of Health for your state and verify that the physician is in fact licensed. Ask the doctor, interview them, and say, what hospitals do you have staff privileges at? Just because they see diplomas on the wall or somebody has a very fancy website or a billboard on a highway doesn't mean that they're a licensed, board-certified plastic surgeon.
It's a very powerful message, and for everybody else out there, hopefully they won't fall into that same trap.
And luckily, this is obviously a unique scenario. We don't want to give the impression out there that, you know, all plastic surgeons out there don't know what they're doing. As a board-certified plastic surgeon yourself, let's give people some tips on ways they can enhance their flat tush, or if they're worried about flat breasts.
I mean, I think
in a
it's a good segue.